A lot of developments in the fight against COVID to report tonight, some good, but unfortunately mostly bad. Global cases, they've now topped 8 million. We are above 2.1 million here stateside and more than 430,000 worldwide deaths. More than a quarter of those deaths have happened in the U.S. We've now lost more than 116,000 Americans. As we reported, more than 20 states still reporting increases in new COVID cases, while some of the hardest hit states, New York and New Jersey, they're showing significant decreases. And when you combine that into one national curve, that curve, it's flattened. Nationally, we are essentially seeing the same number of new cases every day. But then, compare our curve to the curves from Italy, Spain, France, Germany, and the UK, for example. Many had bigger crises than we did, with overflowing hospitals, and some people even denied care. But they've all brought their curves down. The U.S. to this point has not. And that's not including expected increases as more and more people abandon social distancing and other safety measures amid reopening. Or even Trump rallies, the first of which will be mask-free on Saturday in Tulsa. Other nations, they had clear leadership and also messaging when it came to COVID. We have this, and this is from yesterday.
If you don't test, you don't have any cases. If we stop testing right now, we'd have very few cases, if any.
That's crazy. And the vice president, Mr. Pence here, he took what you just heard, that message to heart. Times reporting that Pence, he told governors that if they get questions about new cases increasing in their states, they should just explain it's because of increased testing, even though data has shown that to be completely incorrect. Pence also said governors, they could cite the resumption of elective surgeries if governors get questions about decreasing hospital capacity. There is some real news, though, connected to COVID, as I report tonight, including what may be the first drug to help improve survival rates from COVID. It is a cheap, widely available steroid, and it reduced deaths by up to 1/3 of seriously ill hospital patients in studies focused on in the UK. It did not help those, however, who were less sick. And that report coming just after the FDA ended the emergency use for hydroxychloroquine and chloroquine, drugs widely touted by President Trump. Another study of children shows they are only half as likely as adults 20 and over to be infected with the virus. And among those who do, most do not develop the symptoms of COVID. That could impact decisions on reopening, both schools, camps, and a host of other things. A third new report, it focuses on people with underlying medical conditions like heart disease and diabetes. They were hospitalized for 6 times higher rates than other people, and they died from COVID 12 times more often. Wall Street Journal has been analyzing COVID stats, and by their count, more than 50,000 Americans in nursing homes have died from COVID. That's about 40% of all U.S. COVID deaths. They estimate 250,000 nursing home residents and staffers have now contracted the virus. And a new study from the University of Washington, using the model the White House has been leaning on, it now projects 200,000 Americans could die of the virus by October 1st. They cite people moving around more and the reopening efforts as a major factor. And that model, it jives with another one from Harvard, which also projects 200,000 Americans dying by September. It also says without any additional spikes, the U.S. will see between 800 and 1,000 COVID deaths in America every day. For more, we turn now to Dr. Thomas Tsai. He on the surgery faculty at Harvard, and he was on the team that produced Harvard's COVID model. Doctor, thank you for the time.
Thank you, Richard.
So when we look at these projections, for those of us who thought that we weren't going to get above 100 to 150,000, following the modeling, that number seems optimistic at best. And seemingly what concerns, to the layperson at least, doctor, is we had thought with summer weather, after all the mitigating efforts that we had done in spring and early summer, that we'd be seeing the curve coming down like we saw in Europe. It's not the case, and we're even seeing Arizona and other places, younger portions of the population that are really impacted by COVID. Did we project wrong a few months ago, or are we still just learning about this virus?
That's a great question. And I think the truth is somewhere in the middle. We are still learning a lot about the virus. And what's more important is we're learning about how we're responding to the virus and how that response can dictate the course of the pandemic. The goal of flattening the curve wasn't to just flatten the curve in terms of turning it from a mountain into a plateau, but to drive it down to zero, to come off the mountain, so to speak. What we've been able to do is to hit the plateau stage, but what we've seen the last several weeks is that we've stayed in that plateau stage instead of having it go down to zero. And our goal should be to double down on our testing efforts, our efforts at contact tracing, on wearing masks, following good hand hygiene, so that we're not stuck in this limbo period where we're trudging along with 2,100 new cases a day. We really want to see that number coming down.
You know, I can only imagine when you were constructing the model and trying to game out where this would go, you probably assumed that there would be more of a coherent policy of mitigation, that people would be encouraged by every level of government to wear a mask, to socially distance, etc. And as I mentioned, as early as this weekend, you're going to have the president literally encouraging people to come maskless to an indoor event and sign a waiver so they hold harmless anyone involved with it. How much does that complicate things when people hear different things about what they need to worry about and what they don't?
The lack of coherence in the political and the public health messaging does complicate things for the general public. It's clear that wearing masks is common sense. It works. It helps protect you and others around you from the infection. But we need to be making sure that we are very consistent in that message to the public, so we don't erode in the trust of the public in terms of our political leaders, our policymakers, and our public health officials. So now is a time for clarity instead of creating more confusion. And so in order to break through that, we have to rely on the data.
Doctor, you know, we were led to believe that, hey, the transmission of this in warmer weather, there'll be evaporation, you know, in terms of droplets, et cetera. But I'm looking at spikes when I look at this map in Arizona, in Texas, in Florida, in South Carolina. And we're mid-June. In some of these places, they got 100-degree temps. Did we get it wrong, or is almost the inverse happening? Because it's so hot, people are staying indoors more, and where we thought it was maybe the second wave we wouldn't have to worry about till the fall or winter, we may be seeing it sooner.
Right, Richard. I don't think we'd call it a second wave right now. Rather, it's that for some of these southern states, that first wave never went away. And again, the truth is somewhere in the middle. There's so many different factors at play, not just from the virus itself, but from how society is responding, reacting, and our public health agencies are reacting to the virus. For some of the southern states, in the summertime, instead of being outdoors where there's better air circulation because of the heat, many people are actually staying indoors where there's a higher frequency, higher duration of contact with individuals. And we know that there's a high rate of infection from either asymptomatic individuals or also pre-symptomatic individuals in the days before an individual has symptoms. So the person next to you, even a family member, may have the virus and you're not aware. But also some of these states were also the first states to reopen. So it's also unclear if it's the staying indoors or is it the reopening, going back to the nail salons, to the barber shops, to the restaurants, and that increased social transmission is what's driving the patterns.
I want to play a soundbite. This from Governor Cuomo as they're moving from stages 2 to 3 in New York of reopening, and certainly every numerical metric is on the right side of the curve from hospitalizations, positive tests, and also fatalities. Thankfully, all the numbers coming way down. He nonetheless echoed this warning.
I said to the local governments, frankly, yesterday, this is their job. And if they don't do their job, then they're going to have a really unpopular task, which is explaining to their local community why they have to slow or stop the reopening.
I hear the words, Doctor, but my fear is it's almost an empty threat. Once you've opened the doors, I think it's going to be so hard individually and also on the business levels here to shut them down again, even if I can certainly agree that there's merit medically and scientifically to do so. Psychologically, it's going to be hard. So if people don't use the right mitigation now, are you concerned when you look at your modeling, we're almost at the point of no return?
Yeah, it's hard to dial things up or down if we don't get it right currently. We have to make sure we do all the small things right, the wearing the masks, the testing, the physical distancing. And if we can't get it right now, it's hard to imagine how we can move forward and then dial back and get it right the second time. What I like to see from the governor of New York, but also the governor from all our states, is transparent metrics on what success looks like. So when we have that transparency, we can actually hold our public health officials, our leaders accountable. And I want to see how well is contact tracing performing? What's the turnaround time for tests? Because if that's the way forward, we need to be able to assess these key performance, these key process indicators in order to know if what we're doing is actually working. So I think these metrics, this transparency, this accountability is incredibly important if the public is to trust the process of decision making around COVID-19.
So, Doctor, I hear a lot of, I think, maybe misinformed optimism. I'm not trying to be a downer here, but the amount of people who said, oh, well, you know what, don't worry. President told me hydroxychloroquine is going to be this miracle cure. Now they'll hear that, hey, we've got the steroidal treatment here that's having some real positive impacts on particularly those acutely ill, and we'll have this vaccine by January. Are you concerned? I know you're hopeful that all these timetables and will work and we'll get the right vaccine in the hands of everybody as soon as possible. But are you also concerned that people are given a false sense of when these vaccines or these treatments are going to be commonly available here and how effective they'll be?
Right. I don't think the vaccine is going to come at warp speed. Now, there has been a rapid improvement in multiple different vaccine trials, and I think that's very encouraging. The medications that can help in some of the in the earlier trials, the steroids, we know from other diseases can decrease the overactive immune response to respiratory distress syndromes like COVID-19. But these are all adjuncts. There's tried and true public health measures that work, and we need to do those right. Because if the consequences is if we don't, we are seeing that play out across the country every day with 2,100 new cases every single day, with hundreds of deaths, rising hospitalizations in some states. So we know what getting it wrong looks like. Let's just make sure we focus on getting it right.
Absolutely. Doctor, I always appreciate a few minutes. Thank you so much.
Of course. Thank you.
Up next, the lessons on history and black culture the president did not get before scheduling his next MAGA rally in Tulsa. After the break, you'll get the context he did not, including a primer on a massacre that left hundreds dead a century ago, and also the reason that Friday, Juneteenth, is so important to black Americans.